You might be asking, what should a patient expect in a session? So when a patient comes in for a CureWave laser treatment, they're getting a full continuous wave laser treatment. So you're going to be basically pointing the laser at any targeted areas where they're experiencing the pain and inflammation and keeping it on there for a full minute or two. We don't want to do any more than 2 minutes on any given area. The treatment area is a little bit smaller than my hand, and in areas where there's more damage, they're actually going to experience more heat because there are more cells that are drawing in that photonic energy in order to heal. So areas that have a lot of pain and inflammation and damage might get a little bit spicier, is what we call it. So the patient throughout the experience will be communicating with you. If it does get hotter, you're going to be backing it away. Sometimes you may be as far as 3 feet if they're in extreme pain and have a lot of inflammation in that area. But the most important thing is we want the patient to feel comfortable the entire time. So they might feel really hot for a second and they let you know, hey, it's hot, and you just keep backing it away until they feel comfortable. Because what happens is if their skin gets too hot, then they're going to be getting that response where their skin and their body is now trying to cool it down. It's working against the laser. That's why we want them comfortable the whole time. Even if you are 3 feet away with the laser, they are still getting the most therapeutic results with the laser. So you just work with the patient, have communication, and that human element instead of having a robotic laser is actually really nice because they're able to speak with the practitioner and communicate how they're feeling as well. So you don't want to go beyond 10 to 15 minutes because you don't want to overwork the cells. So you would usually focus on just one treatment area. Sometimes you can fit in both knees in one session, so it just depends on how generous you want to be. A lot of doctors do max it out at about 10 minutes. And that's the most that they'll do for the laser treatment. So it just depends on the practitioner and what they're willing to do for the patient. Cellular healing is a multiple treatment process. So you want to come in probably multiple times within the first week. So you want to come in, if you can, back to back. So 3 treatments, I would say, in a row. You can do one every single day and then maybe space them out over the next week. So if you're doing 5 treatments, do 3 in a row that first week and then have them come in the next week and then the week after that. And a patient could come in every day. So it just depends on how intense their pain and inflammation is. As a laser practitioner, when you're working on a patient, certain areas are going to get very hot. Again, if they have a lot of pain and inflammation, most likely they're not going to come see you unless they have a lot of pain. So areas where it is getting really hot, sometimes you can touch the skin, help it cool down, and also feel how hot the skin is. Then if it's getting hot, you just know that there's more damage there and that they're going to need multiple treatments. So if somebody has chronic pain, they're going to need probably 5 to 10 treatments. They may feel a lot better after just 3 treatments, but you're going to want to space it out and do those 5 to 10 treatments for something chronic, especially if they've had that pain for years. Now, if they wake up with something acute, like a really stiff neck, or they just pulled something, sometimes they can get away with 1 to 3 sessions and that will knock it out. The stiff neck is usually just about 1 treatment. So what would you expect during a demo? So a demo is going to be a 3-day process. We're going to get up to 5 patients and work on them 3 days in a row. So you want to get patients that are really serious about healing, that are into alternative treatments and want to try something new, especially if you haven't found anything that works for them. So let's say that we started on a Monday. We're going to be bringing in these 5 patients on a Monday and we're going to be working with them day 1, day 2, and day 3, and then seeing how their experience is. If they have a lot of pain, sometimes they can get a little irritated after the first session because there's so many damaged cells drawing in that light energy. And then what we'll want to do is just continue to bring them in again for 3 full treatments back to back, and that way they can get the best experience possible, and the doctor can make that decision to make sure that it is the best thing for their practice. As far as what we charge, now national average is going to be anywhere between $50 per treatment. Again, that's for about a 10-minute session, up to $150 per treatment. We do have a lot of doctors that charge upwards of $150. It is cash pay. There are a lot of insurance companies looking at using laser therapy as part of an insurance plan, but for now it is cash. And we do have a lot of patients that are absolutely fine paying cash because it is helping them to avoid surgery, it's helping them get off painkillers, and it's helping to improve their quality of life immensely. So the laser can be paid for with cash, or it can be paid for through a lease. The lease is usually the best option because it is a very affordable payment and you only need about 1 patient a day in order to afford that payment. So a lot of our doctors are making a considerable amount of money with the laser. Some of them are making as much as 250 grand a year, although we can't guarantee how much you will make off the laser. Generally, busy practices are able to incorporate it as part of a treatment plan and right away start seeing a profit on the laser. We have a lot of orthopedic surgeons, med spas, general pain and inflammation doctors that love this laser, family practitioners, pretty much any doctor. The only contraindications are the eyes. We don't want any eye doctors obviously using this laser for the eyes, and never work on a pregnant woman, but that's the only contraindications, is never work on the eyes and do not work on a woman that is pregnant. So any doctor that is interested in the pain and inflammation market, this laser is going to be incorporated really well into their practice. If you'd like more information on the laser, look at pricing options, and have that demo, make sure you give me a call or contact me through my website. So my number is 480-540-8196, or you can contact me at radiantwellnessusa.com. I'm also located on LinkedIn if you'd like to follow me, and message me on there as well.